Any of that
Right.
information.
She's good at that.
To speed on what they're talking about.
People coming
Yeah,
in
it
with,
looks-
well,
I mean,
bucks to spend.
And there was concern
for
about
apartments
access to
and
the
all that kind of
courthouse, and
stuff.
so it sounds like that'll be the break point, north of that, south of that. So, yeah, so pretty good though. There were concerns and they're addressed, and then there's more concerns and they'll be addressed. And so Darren's doing a good job at it.
And we are live.
Oh,
Thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, July 19th at 8:30 a.m. We have our agenda here, and that's included inside the consent agenda. So if there's anything, anyone would like to pull the consent agenda, we should do that now. Otherwise, I'd entertain a motion to approve the consent agenda.
Mr. Chair, I move to approve the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Commissioner Svaleson. Motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Opposed? Motion passes unanimously. That moves us right on down to item 3, staff report. And we have our preliminary budget presentation with Lori Ericson. Good morning, Lori.
Good morning. Still working out the technical stuff. All right, well, welcome to our 2023 proposed budget. I will preface this that this is our preliminary budget. We still have some numbers and some things coming in yet. Oops. Our mission statement was crafted by our staff back in 2014. Cook County PHHS is an integrated agency. We have 3 departments: economic assistance, social services, and public health. Together, we are responsible for the administration of several state and federal programs that provide support for those in need and to promote and protect the health, safety, and well-being of our community. This budget was prepared in alignment with this mission. Payroll is always our biggest impact. Personnel costs include the 3.5% approved COLA and a projected 10% increase in health insurance. We will also have 6 staff, each with more than 10 years of service with the county and will earn longevity pay. 3 of these staff have been here more than 15 years. Training and travel costs will be higher than the previous 2 years due to in-person meetings resuming and the adoption of the GSA reimbursement rates. At this time, I'm not aware of any additional COVID-related grants coming into public health, although I anticipate some carryover of unused federal grants going into '23. DHS has released some of their preliminary allocations for our funding, with final numbers due to go out to the counties by the end of September. Other changes in '23, there's 1 additional FTE, which is included in this budget. With the proposed reorganization of the Children and Family Services Unit, a behavioral health supervisor position is included. The job description for this position is with the Personnel Committee right now, and we anticipate a request to the board for this new FTE probably come in August. While we always try to be planful with our budget, we cannot precisely forecast the needs of the community the next year and how many children or adults that may need to be temporarily in placement. Each year, we thoughtfully budget for potential out-of-home placement costs. However, with reduced placements in recent years, coupled with our increased revenue collections elsewhere, we have had significant returns to the fund balance. Therefore, our '23 budget will again reflect a 2-step approach to addressing these potential expenditures: a reduction in projected out-of-home placement costs and a contingency for using up to $100,000 of fund balance if needed for children's out-of-home placements, children's mental health services, and adult placements. We had previously reduced our '22 budget in this area by 37%. For 2023, we are again reducing the projected cost of out-of-home placements and other program services based on usage trends another 54%. By reducing the levy request with the planned use of fund balance, our 23 proposed budget is 4.12% higher than the approved 22 budget. While the 23 request is a 4% increase over 22, it is a significant reduction from the approved levies of the prior 3 years. You'll see going back into the 2020 budget, this budget for 23 is a 10% decrease from the 2020 budget. Here's where we stand, how the budget is split up by departments. Economic assistance makes up 22% of our agency budget, social services 61%, and 17% to public health. The next couple slides will show just a snapshot of each department.
I'm sorry, Lori, could I ask a question?
Yes.
On the 2 slides ago, where you're showing the last 5 years of the budget, those are actual dollars. Those are not adjusted for inflation, correct?
Correct. Those are what the actual levy amounts that were approved in the budgets for those years.
Okay.
So starting with economic assistance, major changes in this area involve reimbursable client programs such as cost-effective insurance. Based on usage trends, we increased some of these client program costs, all of which are 100% reimbursable. So there is an offsetting increase to the revenue. This results in a net increase to the county cost of less than 5% over the 22 budget. In social services, with the addition of the supervisor in the behavioral health unit and the further reduction in expected costs for children's services, the budget change for expenditures is almost zero. We also anticipate a slight increase in potential revenues. This results in a 3.5% decrease in the county cost over 22 budget. In public health, in 2022, the temporary staff employment contracts expired and 1 permanent position for SHIP was added. Moving this program to a staff-provided service increased the payroll cost, but it also reduced the contracted services. The SHIP grant will continue to offset these costs. Additionally, we will continue to utilize the approved ARPA funding toward the wages of the 2 full-time public health educators throughout 2023. Adjusting contracted services to align with their usage trends further reduced costs in public health. This budget snapshot does not include this budget snapshot does include funding for the Public Health Fund grant program with a tentative recommendation from the Grant Approval Committee. And we'll talk more about that shortly. The biggest change you'll see to the budget for public health will be the reduction of the many COVID-related grants that we've received over the last 2 years. This large reduction in planned revenue will result in a net increase in county cost of 36.5% over 22 budget. Allison will be giving an update on the Public Health Fund grant program in her director's report. Just briefly, the Community Health Assessment and Health Improvement Plan identifies goals to ensure local resources are targeted towards the greatest needs in the community. The Public Health Fund grant program allows us to partner with providers in the community to meet these gaps in services. For 2023, we received applications totaling $242,436. The Grant Review Subcommittee recommended to fund $185,000 pending follow-up questions and further discussions by the group. This amount is in the budget as a placeholder. It is a 34% increase over the 22 grant awards. Using previous methodology to come up with the grant awards, we would have used an incremental increase between 2 and 4%. We put a placeholder in based on what the subcommittee recommended. The actual budget amount for the 2023 grants will be updated when we give our final budget request to the board. And here is our org chart for all 3 departments under Public Health and Human Services. It takes many educated and extremely dedicated staff to fulfill our stated mission. In the blue section on the 3 columns on the left, You'll find Adult and Home and Community-Based Services Team. The next column down is the Children and Family Services Team. The third column down, it would be the Behavioral Health Team, including the new Behavioral Health Supervisor. The red column in the center is our Public Health Department, in coordination with several local and partnerships and agencies have been incredibly busy to keep us all educated, healthy, and safe. The fourth column in green is the Economic Assistance Department, providing assistance for people that are, to provide eligibility support for people that are applying for state and federal services, including health insurance, health programs. And at the top, beginning with our director and including the columns on the far right, that would be our support team. That includes front office support, social media outreach, budgeting, compliance. At 69% of the budget, payroll is the largest expense for our three departments, as we are people serving people. 24% of the budget goes to direct program costs, which includes out-of-home placements, the Public Health Grant Fund, and contracted services. Services and charges makes up 7% of budgeted costs, and that would be for staff training and travel, office rent and IT charges, the electronic data management software licenses, and other administrative costs. State and federal reimbursements equal 40% of our anticipated revenue for next year. Fees for services and miscellaneous are typically payments from private health insurances for chemical dependency services or for the senior health options, estate recovery revenue, and other non-governmental grants. At 49%, the county levy is the largest source of PHHS funding. And a side note, in our 22 budget, the levy made up 55% of our revenue. We are constantly searching for more grant opportunities and improving our third-party collections. So we are diligently looking for outside funding sources. We've applied for several grants, and until those awards are decided, that revenue is not included in the 22 budget. We've applied for a large HRSA grant for the potential funding for substance misuse prevention. There's a small grant with the Healthy Kids Minnesota project. Additional state program funding will be available when we have qualified behavioral health staff in place, and then we can begin the certification process with DHS to become eligible for that funding. The American Rescue Plan funding is included in the 23 budget. We're still utilizing this federal award to offset the wages for the 2 public health educators for work that they perform that is not covered by other grants. We also have ARPA funding allocated for the mental health crisis response pilot project through 2023. So until I find that money tree in the forest, our staff will continue to explore additional grant opportunities on a local, state, and national level. Again, this is our preliminary 23 budget with the information that we have at this time. We still have some unknowns for next year that could affect these numbers. The state and federal revenue allocations, public health and other grant awards. Computers are scheduled to be replaced by MIS, and I don't know exactly how many are going to be replaced next year. The Healthcare Access Program is under review right now. And the Public Health Fund grant budget, which we're still waiting on a final number for that. And of course, the class and comp study. We will provide the board with our final 2023 budget request in August, and that'll include any updates we learn in the next 2 weeks. This budget has been presented with using up to $100,000 of fund balance, which would reduce our available balance in reserves to within 83% of our budget. Here are some scenarios for using different amounts of fund balance, which could further reduce the levy request. And then it also shows the corresponding effect that would have on the reserves. I will make a note here that since just one child placed in out-of-home treatment facility can cost more than $350 a day, or about $130,000 a year, I am cautious of any further reductions beyond what is shown here. And with that, I'll take any questions.
Great, thank you. Very concise. I really appreciate the further detail in the packet too. And I want to thank Commissioner Hawkins for finding that that error and then your work correcting that. So just a kudos there. It wasn't me, I just passed it on. So any questions? I'm sure there are.
Lori, I have a question. When you're looking at the grants that you are applying for, what is the approximate dollar value of those grants you're trying
I
to?
think Allison can speak to the HRSA grant.
Okay.
Yeah, it'll take me a minute to find that. I don't know it offhand. This was a grant that we applied for in partnership with Sawtooth Mountain Clinic, Grand Portage Nation, the University of Minnesota, and other community partners. We initially applied in 2019 or 2020. We did not receive grant funding last year, but resubmitted our application with a few updates. So if you don't mind, will I try
Sure.
to pull that amount?
Absolutely. Thank you for checking on that.
Thank you, Grace.
It's a small grant, it's around $10,000.
Okay.
And it's very likely that we will get that funding, it's just not fully through the process.
Okay, thank you. Appreciate that, Grace.
It might take me a few minutes if we want to move on to the
Sure.
Sure. Any
Yeah.
other questions?
That's fine.
One question I guess it's just a point of conversation, and I really appreciate both the use of fund balance and looking at the impacts of further use of fund balance. And I really appreciate the perspective on the costs, the potential costs of even just a single out-of-home placement. As I think I've talked a little bit about before, I'm really hoping that the county can play a larger role in childcare assistance, or in my opinion, likely subsidy, and as I had reported before, it's pretty easy to get that number to 70,000. And then I'd also heard if there was universal childcare, it's much higher. And it's just interesting to think about those numbers and how it may impact the budget and what budget that would impact. Oftentimes, I feel like public health would be a good place for that. We've also had conversations about the EDA being a better vehicle for that. And so it's maybe a horse apiece. It's tax dollars, but it just thinking about those numbers and looking at this budget, it just helps to give perspective on what kind of impact that would have on a budget, and then also extrapolating what kind of impact would that have in our community, the kind of help it would have, or the burden that would cost taxpayers as well. So, and I assume that hasn't been discussed because we haven't given any direction or made any progress there. And I know Grace is also involved in conversations with the EDA, but it's just something that I wanted to bring up and hope for more progress in the future on it. Commissioner Storlie.
Thank you. Yes, I almost feel like childcare has been dropped. I mean, I don't hear anything in the community, and I think if we're going to consider that for something in the budget for next year, we need to kind of move along. So has anybody heard anything about it? Much? You have heard?
Yeah, I kind of, well, maybe not as much as Commissioner Sullivan, or I saw your
Just
hand.
wanted to mention that the EDA is looking at in their proposed budget, a line item that's allocated strictly to childcare, kind of incentives to help home daycares get started and get up and running, but it's a small amount. But they want to make sure that they're focusing some of their funding on trying to encourage that.
So less than $70,000.
Yes.
And then we've also had conversations with Nancy Deming and the Sawtooth Mountain Clinic about applying for some Blandon Foundation funding for that purpose as well.
Yeah, and Commissioner Storlie, to your point, there hasn't been as much talk about it right now, but there is work being done on that. And I try to bring it up like now,
Right.
Yeah.
and just kind of as often as I can whenever there's an opportunity to try to keep that, that notion alive as far as assistance is concerned. But I certainly hear about it from parents and members of the community on the regular, so the need is still there, obviously, and it does have a significant impact on our economy and families. And so, yeah, I had similar thoughts as far as if we're gonna do anything, we should try to include something in the budget. But it also seems, putting the cart before the horse if we don't have a plan on how to do that. That being said, we did have a similar situation with housing before the formation of any real plan on what to do, but just knowing that we had to do something, so we budgeted for that in the past. So something for us to maybe talk more about now, or if there's any staff input or thoughts. I'm sorry, Rana,
Well, I
please.
just want to say that good child care can enhance the mental health of children and save us money down the road.
Right.
When you look at out-of-home placement.
Yeah, absolutely.
Yeah.
Allison?
Something we had discussed as a next step at the last point that we met with Beth from the EDA was to have a follow-up presentation at a future committee of the whole meeting to cover some of the SMART goals that were developed during the Rural Childhood Innovation Project. And a number of commissioners were in attendance at that town hall. There was a lot of interest in that, so coming back together, bringing those who have been more deeply involved in that process, like Beth, Pat Campanero, Grace, and others, Nancy Deming in particular, to say where are we at with these SMART goals, where are the areas of greatest unmet need where we don't have a lot of capacity to address those goals. So that might be a venue in which we could have more in-depth discussion about who's doing what to increase availability of childcare, support existing childcare providers.
Thank you. So that sounds like significant progress, really. But for us right now, do we want to put a placeholder, or do we want to ask the department to put a placeholder for childcare? And if so, what would that be without any real concrete?
Well, you talked
numbers?
about $70,000. The EDA is recommending for their portion, $20,000 for startups for home daycare. And they're holding that in reserve specifically for that purpose.
For startups?
Correct.
Okay. From what I've gathered in my understanding, that is certainly a barrier starting, but then also just providing service
Yeah,
for
and
current
if
providers.
people want to do upgrades to their current daycare facilities, funding is available for that as well.
Where I see the rub is, and I appreciate that because I'm certain there are needs there as well. Where I see the rub is the difference between what providers can charge and what they can afford to pay or bring in. And so that's where I see a subsidy that's needed. And, I'm not saying there is not a need for startups, and I'm not saying there is not a need for improvements, but that just straight up subsidy is where I see the biggest rub, the biggest impact. And that's where that 70,000 number came from. But again, we don't have a mechanism in place, we don't have a system, we don't have an application process at this point. But I think we can develop that, and with partners. But it's just, I don't know, and I'll maybe look to James here too, I just don't know, and Allison, where the most appropriate budget, where that placeholder would be in budgets. If it should be through Public Health and Human Services, or if we should push more towards the EDA, or but I would like myself to put a placeholder somewhere.
Mhm.
So, sorry to drop that on you right now, but.
No, it's a fair question. In a lot of ways, it feels like Public Health and Human Services would be the appropriate place to budget that money, because we already do oversight of childcare facilities, so that expertise is there. But as you point out, I mean, the dollars are all coming from the same place, so whether it goes through the EDA or through the county, the impact is the same for taxpayers. So the question is just, how can we most effectively, I mean, it depends on how those dollars are going to be used, right? And how do we most effectively administer those dollars, depending on what the purpose is.
Exactly. Commissioner Storlie?
Yeah. Well, government just moves really slow. And I think a placeholder would be important for the community to know that we're serious. And even if there's already 70,000 with the EDA,
20,000.
20,000, we match it with another 20,000. I think we need to show the public that we're, sincere about this and we want to see something happen. So however we want to do that placeholder for August discussion, since we'll have the budget by then. But I think we need to show the community that we're moving along with it. Not a big deal, but, placeholder, smaller
Okay.
support.
One thing I would add is, when I think about, we've all heard the statistics about how many childcare slots are needed versus how many there are. And I think about a number like $40,000 between the EDA and the county, and that just seems like a drop in the bucket. I mean,
Yeah.
in terms of addressing the enormity of the problem.
Sure.
But I also recognize we don't have a fully formed plan yet, so maybe that step is appropriate, but.
Or a faucet to fill the bucket with.
Right.
I'm sorry?
There's that.
Yeah, and I don't know what an appropriate number would be. I don't think we're in a place to do universal childcare. That's, I think, a little beyond our financial abilities. But I do want to make as impactful of a difference we can with the subsidy, so, yeah. I would like to do more than 20,000. I don't know if we need to do the full 70. Again, that was an approximation for what some kind of impactful subsidy would cost. Commissioner
Can you
Hawkins?
explain how you came, or somebody came to 70,000?
Yeah, I think.
Why was that number chosen?
I hate to, I'm not certain who, I've been talking to different partners that are involved in it, so I hate to name whoever it was because I don't remember who it was. But I believe it was, that number was what it would take to bridge that difference between what families can afford and what providers can charge to make it a more viable business, and then spread that out over the current providers.
I guess I would like to see
See more
more.
of that. Yeah.
I want to see more data in the calculation.
Absolutely. That's very fair.
Formula that's used to figure that out. yeah.
Absolutely, yeah, that's very fair, and I think we need to have that before we approve anything. But again, I just want to be able to keep staff prepared. Yeah, please, Larry.
Just to throw this as an offer out there, when I present the final budget then in August, would it be appropriate to just raise the amount of the fund balance request usage by the amount that you are deciding on? So for instance, right now, we are requesting to use 100,000. We would then put in our request to use 170,000. That way there's a placeholder there and there is not a taxpayer impact at this time.
Yes, thank you. That is where my mind was going, and when I was looking at those impacts, it seems like a safer route and as just a placeholder, and then we can get more data and really try to nail this down and drill into it a little bit more. So thank you for that suggestion. How does the rest of the board feel about that? Or Yes, James.
Mr. Chair, I'd just like to note, public health does have its own fund balance, as does the highway department and the general fund. And so thinking about how all the pieces are going to fit together ultimately with the budget, where I expect that we're going to be using fund balance in highway and the general fund as well to offset levy increases this year. And I think it's going to be important really to look at the big picture. We're doing the budget proposal for the general fund next week at the board meeting. And so we're going to have to see kind of how those pieces fit together to see how much fund balance we need to use in each area to keep the levy at a level that you all desire. So this is, we can talk about the public health and human services fund balance, but we can't really consider it in isolation because there are these other pieces to look at.
Yep, absolutely. Thank you. As far as a placeholder is concerned, are you not comfortable with that?
No,
Okay.
I'm not suggesting that you
Okay.
not do that. I'm just saying there's a larger context for the
Yes,
discussion.
thank you. I appreciate that. Well, how does that placeholder sit with the fund balance? Please, Grace.
I just wanted to add, when I would be happy to work with partners on putting together a committee of the whole presentation and working out different scenarios and trying to play with some numbers on, how you all might want to structure things and how we can actually kind of try to quantify needs. It would be helpful to get feedback from you all in terms of what you would want to see in that kind of a committee of the whole work session. But and I don't know how the timing will line up with August and with a work session, but it feels like that. I'd be happy to play that role in trying to put a next step somewhere.
Thank you. And it might require a special meeting, just timing-wise, because I think we really do need to flesh this out a lot more, to Commissioner Hawkins' point. But to Commissioner Storlie's point, the community really does need action. So if we could do that, I don't know how our availability will be before the committee of the whole, because, clearly that timing won't. At August's Public Health Human Services meeting, then the committee of the whole is after that. So we'd have to do something, a special meeting before that. That reminds me that, and this is just my idea, so it doesn't mean we have to do this, but that a similar process to the public health grant fund for that childcare. So I don't know if that's a structure that would be appropriate or a model to work with, but it seems like that could be. So far, I've been very impressed with that process, and so that's why I think it might be worthwhile emulating that. So, Commissioner Storlie.
I was just looking at our calendar. Would we possibly want to, August 9th, have a discussion after our regular meeting? Just everybody bring some ideas as to how we can move forward and give Grace ideas for the committee? Rather than have a special meeting, we could tag it on to the board meeting at the end?
We would have a scheduling conflict with that date, just staffing-wise, on the 9th.
Oh, I'm just talking about the board, putting ideas together to present to you. Because your meeting is going to be the 16th. I don't know.
Or the 17th, right?
Yeah.
Yeah.
Try to piggyback already the meetings that we already are here for.
Oh, so you're saying the 10th, actually, right? August 10th, Tuesday? Or am I?
You're in the wrong, no, August 9th is Tuesday.
9th is Tuesday.
Boy, I have my whole calendar wrong. Sweet.
Look at mine there, August.
I'll pull up my E1.
Okay.
It's in ink, too, so what am I going to do?
We have whiteout.
Yeah, sure enough. Yeah, I also have, it's hard to know how long that regular meeting would last.
Yeah.
I just wonder if Grace might be able to talk with Beth and Pat and Nancy and help suggest a framework for us. I think that might be more helpful than us just kind of spitballing out ideas.
Well, yeah, if we do have some ideas, though, kind of like what I was saying with the process, we can pass them on to Grace if
Yeah.
she's receptive.
I think
and
that would be fine.
Assume she's receptive to ideas, and then just let you develop or try to sift those. Please, Rana.
I don't think you should, it might not be a good idea to limit this, if you had $70,000, to say it's specifically to help people already in childcare, because that doesn't address the issue of more childcare
Yep.
needed, and people might react negatively to that.
Yep, yep.
Depending on where they are. I mean, it's, obviously both are needed, but just
Yep.
as a, I don't know,
Keep our options open.
leaving it open, yeah.
Mhm.
Yeah.
That's a great point, yeah. Because the needs, certainly the needs will change, and then where the dollars are needed would also change. As more providers enter into our community, or yeah, just if things are more affordable too, that'll shift the dynamics somewhat. Well, so how do people feel about that placeholder for the time
I like
being?
the idea.
And then,
Right.
okay. Well, I don't know if we need action on that. We'll just give an ask, and then thank you, and thank you, Grace. And then we'll see what we can pull together for August, and then we'll try to schedule something before the August PHHS meeting, just to get kind of what you've been able to gather. Does that sound reasonable? Are you thinking processing, Allison?
Well, the next committee of the whole date would be just after our
Right.
August public health and human
Right,
services.
so, yeah. So we have that. How does, well, I feel uncomfortable now that my written calendar is all messed up. Trying to figure out a date. Well, my hope is that we'd be able to do something before the August PHHS board meeting. And so I don't know how we can best schedule that, but I'll lean on James in April maybe, and try to pull something together here to discuss further and see what our options are.
Okay.
Also, I think that maybe we can research what is the funding possibilities out there.
Oh, yeah.
I've heard things like Northland Foundation.
Yeah.
I've heard other entities coming in, and so now it's like, okay, let's line them up and see if they really mean, what they have offered and I'm talking like the last 2 years. And, here we are. And there's been, EDA is the first one to kind of step up, so keep the ball rolling.
Yeah, and I think there is money out there, and I think Nancy Deming is exploring that, and just what our options are, but I think it is important that we show our support. I haven't heard anything from the state, aside from the needs statewide, and I also, from our AMC meetings, know the demographics, our workforce is not growing, and so in my mind, our best bet is to encourage people to move here, and if we have assistance with childcare, it makes it a lot easier for people to move to an area. And so if the state were to do that, it would make it easier for people to move into the state. And that's I think, something that would behoove, our state legislature too. So if we can, request that we do a pilot of something like that, they might be willing to help. But I don't know who best to talk to there, whether it be deed or, well, yeah. I think there could be options, so. Very good.
Mr. Chair,
Please.
so just looking, and I know you said you're uncomfortable trying to schedule something because of your calendar issues, but while you're all here, I'm just wondering, so I'm looking at the week of August 1st, and I'm wondering how either the first thing in the morning or the afternoon of Tuesday, August 2nd looks for folks. Allison, did you say that was a date that you were unavailable, or that was the 9th, right?
That was the 9th.
9.
I will not be here.
You'll not be here.
And the second.
I'm not available in the afternoon. I could do something in the morning.
Okay. So we've got one commissioner
I can
out.
do it.
You can do it. Commissioner Hawkins. Are you just out that day then, or?
I'm out of the area.
Yeah, okay. Let's see, looking into the week of August 8th, how about the afternoon of Wednesday, the 10th?
Oh, wait, Wednesday, the 10th is after our, oh, yeah.
After the board meeting,
It's after the board
but
meeting.
before cow.
Yeah. Or Thursday, the 11th.
Oh, I'm sorry. Yeah, the 10th, I'm good, I'm done at, I think, 1:30.
Okay.
I'm good to go there.
Oh, shoot. I just realized something. That morning's not good. I could do the afternoon, though. And the 11th, how does that look for folks?
Very good for me.
Wednesday, I have to, N Club is asking for their annual meeting to be beginning that evening and then goes into Thursday.
Okay.
But it starts, they have, it's just like where they're having a dinner, which that'd be all right,
So,
And this is
okay.
going to be over in Grand Rapids.
Okay. So like a 1 to 2:30 kind of meeting would be doable?
Yeah.
On Wednesday,
Wednesday, the 10th.
Yep.
1 to 2:30.
Between Grace and I, one of us could make that work. Yeah.
Okay. Okay. We will work to schedule and notice that meeting for 1 PM on Wednesday, August 10th.
Do you think that would work for you, Rana?
I guess, I was just gonna ask, is that my job too?
Well, if it comes before this board, I
Yeah.
think it's important that you're
Okay.
part of the conversation, and then, of course, it will have to just go before the county board as well,
Yeah,
but I just
okay.
think your perspective from the mental health side of things would be valuable.
I think so, but,
Okay. You don't have to.
all right. So you're talking about 1 o'clock
1 o'clock on the 10th.
on the 10th?
Make sure the commissioner's room is available too.
Commissioner Mills?
Yes,
I
please.
don't want to move us on prematurely, but I do have those HRSA budget numbers.
Oh, yeah, I think we're pretty wrapped up with this conversation. We've got something scheduled and a placeholder. Please go ahead.
Okay, so this is the budget from the last application period, so I'll give this with a caveat that it might have changed slightly, given our most recent application, but it's in the ballpark. So this would be a 3-year grant program. Year 1 would begin in September of this year. So for year 2, which would include part of 2022 and 2023, that total amount is approximately $50,000. And that would fund one of our public health educators at 0.5 FTE and would include fringe expense, travel, and supplies.
So that's 3 years, so it's
3 years beginning in September of this year.
okay.
Year 1 is the same, it's approximately $50,000.
Okay, yep.
Year 2, approximately $50,000. Year 3, slightly more, because the program would be more fully developed at that time. There would be more travel and supply expenses.
Okay. Thank you.
Thanks.
Boy, that'd be great.
10th is fine for me.
Thank you. Very good. Okay, well, any other questions for Lori?
Just thank you very much. It was
Yeah.
an excellent presentation.
Really appreciate the format as well as the strategy. So thank you for your work on that. Thank you, Allison, for your work, and Grace as well.
And I'd like to say thank you as well. You guys have a really complex budget with a lot of different funding streams, and I know it's a lot of work to keep it all in order, and you do an exceptional job with that, so thank you.
Thank you.
When you talked about the skills and the education of the employees we have in our org chart, I thought you would be, before you said the employees, I thought you were going to say what it took to just make the org chart.
It's amazing what you can do with Excel.
All right, well, I guess I'll move on to item 4, the COVID-19 situational update. Good morning, Grace.
Hello again. All right. More news on COVID-19. So our cumulative case count, let's see, we're at 1,139, which is up 67 since the last PHHS board meeting, with no new deaths reported in that time period. Our COVID-19 level using the CDC county level tracker remains at medium. It has fluctuated in the last 4 weeks. It changes every Thursday night. So every Friday morning, we update all of the signage in the county and try to get that out on social media. So again, that tool takes into account the case rate over a 7-day rolling period, as well as regional hospitalization data that looks at percentage of bed use for COVID-19 inpatient care, as well as new COVID-19 hospital admissions. We do, across the state and across the country, we are seeing a wave of cases due to a subvariant called BA.5. And so again, every time that COVID-19, the virus that causes COVID-19, gets into a human body and starts to make copies of itself, there's a possibility that it will change slightly and mutate. And so that's what's happened with BA.5. There's been changes to the spike protein that makes it more able to evade immune protection. So one thing that we're learning is that people can become infected with COVID-19 multiple times after being sick in the past, after vaccination. And so with BA.5, we are seeing people reinfected and infected quickly because of this mutation to the spike protein. So thankfully, the vaccination still is offering very powerful protection against severe outcomes like hospitalization and death. It's also a huge help to keeping our healthcare system functioning. And we still do have treatments available to those at highest risk for severe outcomes that work well even against this new subvariant BA.5. The biggest news moving into the world of vaccination is that since the last PHHS meeting, both FDA and CDC recommended both Pfizer and Moderna vaccines specifically formulated for 6-month to 5-year-olds. We did host a successful first dose clinic for 21 children. We've had 9 additional children vaccinate elsewhere, so of the about 200 children in the 6-month to 5-year age range throughout the county at this point, we have 30 who've received 1 dose. We're having a second dose clinic for this age group on August 3rd, and after that, this vaccination for this age group is moved into Sawtooth Mountain Clinic, so people can call the clinic to schedule. They'll also be offered COVID vaccination alongside routine childhood vaccines in well child care and well child checkups. So we are continuing to support vaccination by pointing people to Sawtooth Mountain Clinic and also working alongside the clinic with targeted outreach and communications. So we're working on a postcard mailing to remind Cook County residents to remain up to date on vaccination. We're also working with the provider team to make sure they have materials and support for having those one-on-one conversations with families and well child visits. So back to that up to date at this point with the approval of vaccines and the rollout for the under 5 group. We have had a 1.1 increase in the percentage of Cook County residents who've received at least 1 dose of vaccine. At this point, we're at 87.5% of the county with at least 1 dose of COVID vaccine. However, only 45.25% are considered up to date at this point. So that is our big project, to try to increase that number of people who are up to date. Even 1 dose does provide some protection against severe outcomes, but that protection is most optimal if you are up to date with the number of doses recommended for you. So that is a big project that Andrea Tofty is really taking a lead on in collaboration with the clinic at this point. We're also expecting, following a late June meeting of the FDA, that we will have a new booster in the fall and winter season. That's what they call bivalent. So that means basically the vaccine shows your body how to protect itself from the original variant of COVID-19. But a bivalent vaccine would also show your body how to protect itself against, in this case, the Omicron strain. So that BA4, which was the original Omicron, and BA5. So it would be a vaccine that shows your body how to protect itself against both types of the virus. That's the recommendation of the FDA to the vaccine manufacturers at this point. So we don't have a whole lot of detail other than it's on our radar that we very well might have to do a big mass vaccination push in the fall and winter. And what that means functionally at this point is that we're looking at sites where we would be able to do that. I'm happy that the curlers are going to be able to use the rink space, but that we are going to have to look at other sites where we'd be able to accommodate a large number of people for vaccine activities in the fall, winter. So we're doing some pre-planning and trying to figure out places that would be appropriate venues for that if we do indeed have to do a big push in the fall/winter. Hopefully, although I'm not sure, maybe it could coincide with the flu shot push. That would be a really nice overlap. But we'll see what the timing looks like with that. In other news, I mean, a lot of what we continue to do is the same as it has been. We're continuing to take calls from people, answering questions about isolation, quarantine. The real benefit right now, aside from making sure people have accurate information on public health recommendations after testing positive, is to make sure if the person's at higher risk for a severe outcome that they know that they can connect very easily with antiviral treatments at Sawtooth Mountain Clinic. And that is something that a person needs to have a visit with a provider to see if they'd be an appropriate candidate for. But I'm very proud that we have that strong link. Sometimes it's called test to treat. We are, I think, able to keep people from falling through the cracks fairly well in Cook County at this point by working with the clinic. We still are fielding probably 1 or 2 calls a week for technical assistance for businesses and events about infection control. Either there's been an exposure or they want to pre-plan so that there is less likelihood of an exposure. We also this past month updated the COVID-19 hub site. I encourage you to take a look. It's cookcountycovid19.org, and it has all the most updated recommendations from the CDC, but it also has information about locally how to access testing, how to access vaccination, where to call for treatment for COVID-19. And again, thank you to Andrea Tofty, who worked with Kyle and MIS to really make those updates happen. Andrea is also continuing to offer weekly testing at ISD 166 in the school nurse office during summer programs and in the afternoons at the community center on Wednesday. That's going very well. She has a small number of regular attendees and also is able to offer a really nice option for exposure-based testing for people in youth programs and who have children and who might be, traveling and just want to check and make sure that they're negative before getting together with a large group of people. So that program is continuing on well. And I would say those are my updates with COVID-19 at this point. The real big news, the real exciting news is the vaccines for the under 5 group. So at this point, everyone 6 months and older is able to qualify for COVID-19 vaccines. So.
Thank you, Grace. Any questions for Grace? I had a question, and sorry if you just said it and I just missed it, was about the age of the second booster. If
the second booster.
The general.
So there have been kind of rumblings that it might be recommended for people younger than 50, but at this point there is no formal recommendation. So it's kind of a stay tuned situation. We still have to wait for CDC and FDA to provide their feedback, and then we'll take it from there. But it is possible that could be authorized sometime in the coming months here. I just don't know any more
Yep.
detailed information.
Thank you. Appreciate that. That was my only question. Anybody else? Thank you for your work, and I'm so sorry that it continues with COVID.
Well, I was very excited that my own 2-year-old was one of those in that
Yeah,
6-month to
yeah.
5-year group. It was fun to have him in the vaccine clinic, not helping set up in the baby carrier, but actually getting his vaccine.
Yeah,
It was
yeah.
nice.
Congratulations.
Yeah. Well, thank you all.
Thank you.
All right, well, have a good rest of your day, and we'll move on to item 5, Director's Report. Allison.
Thank you. Thank you, Chris. Let's start with staff updates. Christina Matson started last week as our new part-time SHIP coordinator and public health educator. She's away today for training or a meeting, but we anticipate having her come to the August meeting for an introduction and welcome before the board. We are in the final stages of recruitment for our eligibility specialist position and anticipate having a recommendation to hire later this week in advance of next week's regular board meeting. We are continuing to recruit for a children's mental health case manager and the coordinated mental health crisis response worker. Both of these positions have been reposted multiple times. We're waiting to hear back from the merit system at this point on whether we have new applicants from the most recent round of recruitment. Finally, we will be posting this week to backfill the family services case manager following Reed's resignation. So I want to thank Reed for his years of service to the department. Department updates. If you read this week's county newsletter, you saw the recognition for our children and family services team and our economic assistance and healthcare team for their work over the last reporting period in achieving and exceeding all performance standards for the Department of Human Services performance management system. So these are mandates that we and all other counties are held to as it relates to the effectiveness and efficiency of the services that we deliver to Cook County residents. So the particular areas that were measured in this most recent report were child safety and permanency and self-support index, which is a measure of the economic assistance cash and employment services that we provide. What this means is that we don't need to complete a performance improvement plan to develop goals on how to improve performance, but most importantly, this means that the families we're working with are safe, they're in more permanent situations, they're placed with family members, and have stability in their living situations, and are economically secure. So kudos to those teams for their excellent work. You heard an update on the Public Health Fund this morning in Lori's budget presentation, but want to give you a bit more detail on our next step in that process. The Public Health Fund application period closed on June 27th. We received applications from 8 local nonprofits requesting a total of $242,436. For 2023. The Volunteer Grant Review Committee met on July 7th to review and discuss and score all of the grant applications. The initial combined total that the review subcommittee recommended to fund was, as you saw in the budget presentation, $185,000. This is contingent on follow-up questions to some of the applicants and further discussion by the group. The review subcommittee is scheduled to meet again on July 19th to further discuss and refine its funding recommendations, so later today. We moved the timeline up this year based on feedback from the review fund subcommittee and this board to be able to provide a more informed budget request based on anticipated need. And again, I will bring a more detailed update and funding recommendations to the August Public Health and Human Services Board meeting after the subcommittee has had the chance to come back together and finalize their funding recommendations. In terms of our outreach efforts this month, our local mental health advisory council met last week to discuss the launch of the new nationwide suicide prevention hotline, 988. We discussed how best to promote this new resource locally, and other locally and regionally available crisis response resources. So we do anticipate sending out a media release and some outreach materials this week. As a follow-up to last month's meeting and questions about the original term of the ISD 166 testing agreement, I was able to dig into my planning notes and review the meeting minutes and discussion, and can confirm that this wasn't indeed a typo on the date. Contract management is a recognized area for us for process improvement. We work with a lot of different contracts, locally, state, grant contracts. And we've made some strides in recent years improving our processes using tools like DocuSign to improve. But again, this illustrates the benefit of having multiple eyes on things before they go to the board. So again, apologize for that error and the confusion that resulted. And those are my updates. I just have a note from April, who sent me a message that the board didn't motion and vote to approve setting a special meeting for the August board meeting, so that would be her recommendation under items for board action to ensure that the board takes
Good thing.
formal
Thank
action.
you, April, yeah. Thank you, Allison.
Excellent.
Before we do any motions, any questions for Allison? Well, then I'd entertain a motion to set the special meeting of the Public Health and Human Services Board for, what was it, Wednesday, August 10th at 1 p.m.?
That is correct.
Commissioner Storlie, thank you. Is there support?
Support.
Thank you, Commissioner Sullivan. Any further discussion? All in favor? Aye. Opposed? Motion passes unanimously. Thank you again, April. Thank you, Allison. Thank you, board. All right. Well, no questions for Allison. Then we can move on to items for board
Mr.
action.
Chair.
Oh, I'm sorry.
It's okay.
Commissioner Storlie.
I was just wondering, on our packet, page 55, I don't know what that pertains to, the CCMNRJ, it's the alphabet here, May of 22 report. Is that from your department, or?
So this is from the Cook County, Minnesota Restorative Justice. Is that what that alphabet
Oh,
soup
okay.
means? So this was attached to the agenda as an attachment to committee reports. Inger provides this report to members of the advisory council, on which I serve, as well as Commissioner Hawkins as our board representative. So just including that to supplement Commissioner Hawkins' verbal report as information regarding that program.
Okay.
All right. Thank you, Commissioner Storlie. Any other questions? Well, then we can move on to items for board action, of which there are none. So we can move on to our committee reports. First one is the Active Living Steering Committee. Commissioner Svaleson.
And we did not have a meeting this past month. Looking forward to our new ship coordinator and holding our first meeting in August.
Thank you. Similarly, for both AUA and AHA, I gave reports last month, and move this on to ARC. Commissioner Hawkins.
Yeah, we had our meeting on Friday. Lots going on, and, oh, there it is. Preliminary budget was discussed. There will be an increase in Cook County's share of just over $13,000, so that's something to be aware of. That will be impacting our general fund. It was unfortunate that our state legislature didn't pass a tax bill and increase community corrections funding like we were expecting, so this is Cook County's preliminary amount that we will need to increase for budgeting purposes. And that's, I guess, really not a whole lot more to report from there.
Thank you.
Yes. I'm sorry. The part that I really enjoyed of that meeting, besides the budget, they are starting labor negotiations. So it was very interesting to learn. We went into closed session as a board to discuss process and how to approach labor negotiations, and I have the least experience on the board. So it was very interesting to me to sit on the board with people that have been doing this for 20 years.
Oh, great.
And it was very eye-opening for me, so. That was a fun part of the meeting that I can't talk about.
Well, I'm glad you're getting that
Yeah,
experience.
it was very informative. So just wanted to share that. So that will, obviously, I mean, they're
Potential,
hoping to
yeah.
have a longer-term contract like we all want, but we'll see. They're just starting negotiations, so that might have an effect on our budget, too.
That's what I was going to ask, is what assumptions are made in the current budget? Like what percentage increase for?
That's
You know-
probably what she's not supposed to talk about.
That's what,
Oh, well,
as I'm
the
driving
budget,
home,
though.
I thought I would say that, but I realized that part was
Oh.
only in the closed, that never got said in the open meeting, so I'm
No, you
careful
should-
about what
you
I
should
should
share
say
it,
and
yeah.
what I shouldn't. But I'm
It may
sure
have
that
factored
will.
into that. It may have factored into that as an idea, Dave, but they're not ready to reveal what they're,
Right. So
that's
I'm,
part of their negotiating tactics, I guess.
Yeah, okay, yeah.
I don't know that
Thank
for a
you.
fact,
So-
but
Yep.
I've just.
Nope.
I'm-
I
if-
realize,
If
yeah.
they only talked about it in the closed session, I wouldn't want to talk about it.
I realized on the way home, ooh, I was gonna share that, but I better not.
And I respect that. But just out of curiosity, are they assuming an increase in COLA in their budget?
Yes.
Okay. Good. Because that'll probably happen. That is rough to hear, though, about the 13,000, so, thank you for sharing that. All right, that moves us on to the CHB. I have nothing to report there. And then the Cook County Local Advisory Council for Children's and Adult Mental Health. Rana?
Okay, well, Allison did cover, we spent a lot of time on the 988. Very excited to see that. And also, there's a program called Got Your Back, which is for teens. And there's a YouTube video on it, and that's in process of helping people feel that they have support when they need it. And that's about it. I don't think we talked about too many other things. You know, the recruiting new employees, of course, is always
Mm-hmm.
an issue. So I
Okay.
think we've covered pretty much everything that, we have talked a little bit about hoarding problems that people have and some references for that as a mental health subject, especially with older people, but something that is occurring, you know, so. Just to be aware of that.
Thank you. And I think, have we talked about Got Your Back on this board? Okay, yeah. I was going to give a little more on that, but if we've already talked about it, then I won't. Thank you, Rana. Moving on to the Cook County Restorative Justice Committee, Commissioner Hawkins.
And, yeah, I see our mayor report is on there. We are not meeting in July, so our next meeting's August, and I'll have something to report next month.
Thank you. Council on Aging, Commissioner Sullivan.
Well, the Council on Aging is one of the 8 nonprofits that did apply for the public health grant, so they're anxiously awaiting to hear back. They've been working on restructuring their director and program manager roles and are successful with that. They've hired a cook and had an opportunity to train some volunteers to assist in the kitchen, which has been really good. And then the group was able to secure a grant through Operation Roundup through Arrowhead. And with that, they are purchasing safety equipment to enhance the safety in their facility. So they're very, very busy right now. Emergency Preparedness Committee, which is the next one, we did not meet this month. It used to be before COVID, that group met every other month, and this is the first month they've taken off in a year and a half. So, nothing to report.
Thank you. Healthcare Planning Committee, Commissioner Storlie.
We did not meet.
Okay.
So going on to NACO, they're meeting out in Colorado next week, and I won't be attending, but I've been part of some discussions. And as Allison reported, as of Saturday, the 988 National Mental Health phone number went into effect. However, discussion that we've had at NACO is that everybody has to be patient because there aren't enough people who can help with a phone call right now. So, once that gets underway, I think it'll be a good way for people to get in touch with someone somewhere. It won't necessarily be Cook County or Minnesota or wherever. It's whoever receives that call. So, as in new things, they have their starts and and hiccups and all that, but hopefully it'll smooth out after a while.
Do we have an idea of how it's being planned to be dealt with in Minnesota and Cook County?
So in Minnesota, one of the responders to the national line is First Call for Help, which is our regional crisis line that's already existing. But as Commissioner Storlie mentioned, there are some concerns at a national level in terms of the capacity to be able to triage the volume of calls, which is why we discussed at our meeting last week with the local mental health advisory council to really promote that resource alongside other local, regional, and state resources for crisis response. The concern is that call could roll back to the national line, in which case someone might get a responder who isn't as familiar with local resources and just the remote nature of our community.
Okay. And during our local mental health advisory council meeting, I emailed the contact person for the Minnesota rollout to try to get a little more perspective on this, and haven't heard back, unfortunately. I'm certain they are overwhelmed with concerns from others, so, but I'll certainly let people know. But what have I been hearing on the radio? There's an expected increase of 30% usage because of how, simple and easy the number is to remember. And so that's wonderful that people will be reaching out more, but it is quite concerning if we don't have that capacity.
Right. That's where my concern is.
And it's also for people, not just like if you personally feeling suicidal or something to call, but a family member, loved one who's aware of this can also call and get help.
Yeah, yeah. And our use of First Call for Help is new, and I've been hearing very good feedback on it's what they do and triage things well. So I'm very hopeful for our region that we're well placed, but time will tell here. Let's see, Northeast Minnesota Office of Job Training Program, we did meet. It's one of the takeaways there was it's the second time it's happened with this organization, and they're not looking for it, but they've had employees, there's different branch offices, satellites, they've had employees that have been two-timing, having two jobs, basically 2-day jobs that overlap. And so that was something that was brought up at this meeting, that they're not looking for that. And in this particular case, it wasn't 100% overlap, but there is overlap. In the previous case, and this was a couple of years ago now, it was just a straight up working for two companies at the same time. It's just really interesting. It's not something I'm familiar with or have heard of before. I mean, clearly in Cook County, everyone's got multiple jobs, but that overlap part was just really interesting. And I don't know what to make of that. I mean, apparently there's a need. We all know of the labor shortage as well. But then there's, of course, the ethics of that. And so they're working through that. And I'm happy that it was brought to the board's attention and just that it was discussed, and it's just a really interesting situation. But there's lots of changes going on with, and I think I've talked about this, with deed pulling out of a particular office and not renewing a lease, and where that puts the organization. And so there's a lot of flux there, but I feel like they're responding well, and this particular organization has a much larger impact outside of Cook County, but it's just one of those that I appreciate getting that perspective and what's going on in the region. So North Shore Collaborative did not meet, and Public Health and Human Services Advisory Council. Bev is not here, and I'm not expecting her, or do we know?
I haven't been in contact
Yeah.
with Bev since her transition. I tried to reach out, but my
Yeah.
hope is that I'll be able to connect with her before a September meeting, and if she's needing to step down, that we could appoint a new chair and member.
Yeah. And Pat Campanero is willing to step up and chair this past meeting, but I don't think that's her intention for a long term, so. I don't know what to report on that, otherwise, racking my brain. I guess I could look at the past agenda, unless there's something that's on the top of your mind from that.
We haven't met since our last PHHS board meeting, so not much to report from the advisory council beyond the Public Health Fund subcommittee
Oh, yeah.
activity. And many of the members participated in the review of the Community Health Assessment and Improvement Plan, that virtual meeting, which is now posted on our public health website.
Thank you. And then, last one is for the good of the order. Anything for our catch-all there? Really appreciate the board's willingness for that placeholder for childcare. I think it's a good move in the right direction. We'll have to dig into those numbers and figure out what makes sense and what's viable, so. That brings us down to adjournment. Do we have a motion?
I'll make the motion.
Thank you, Commissioner Svaleson. Is there support?
Sullivan supports.
Thank you, Commissioner Sullivan. We are adjourned.
So you're not able to come to the Thursday meeting of the